I'm Robert Sparrow. I'm a development economist. I'm specifically interested in development policies, social policies, looking at effective policies to assist the poor in their daily need. In the last few years I've been focusing mainly at health policies in Indonesia. These include things like social health insurance programs for insuring the poor and households in the informal sector from the economic risk from health shocks. And I've also looked specifically at decentralization of health policies to local governments and how effective local governments are in meeting the needs of their local populations. The Indonesian government seems to be committed to reforms in public health care, but there's still a lot of challenges ahead, and a lot of these challenges relate to the issues that we look at in our research. For example, Indonesia is now planning to include or to provide social health insurance for the full population, but there are still a lot of problems in trying to include the poorest households and households in the informal sector in those policies. And there are a lot of lessons that Indonesia can learn from other countries who've been struggling with the same problems. But there are also other challenges and topics that are really specific to Indonesia, from which I think other countries can learn. For example, the way Indonesia has decentralized the service delivery to districts and district governments, and how these governments are accountable for those services that they provide to the local populations. That decentralized context is fairly unique and very specific to Indonesia, but there are a number of lessons that we can learn on functioning of local governments for other countries.